What's going on, everybody? It's your favorite physical therapist, Jared, coming at you with resilient rehab and wellness. And today it is Movement Monday. So, the movement I wanted to chat about today, you're going to see in this video right here. We're going to see how this editing works. The video that we're going over today is straight leg raises. That's the movement, okay? Now, why straight leg raises? Because I feel like straight leg raises have been shunned by the physical therapy community, and it irks the heck out of me. Okay, sometimes less is more. I know it's not a fancy exercise. I know it's not this elaborate, fun, dynamic, super intense calisthenic movement. Remember, guys, the whole point, the whole part of going through a rehab process is that you have to start with the foundational pieces, the building blocks. You gotta walk before you can run, okay? And that's why we're going over straight leg raises today. Yes, they are beneficial. There's a time and there's a place for them. So if you're my post-op, let's say ACL, MCL, LCL, meniscus, total knee replacement, maybe a hip related injury, right? And you've been cleared to work that hip flexor. Maybe you're non-weight bearing for an X number of weeks because of a fracture in the foot that is waiting to heal. Whatever it may be in that limb, I promise you that there is a point, there is a time where straight leg raises can be very beneficial for you. Okay. Now, with that being said, should they be done forever? Not necessarily, but I promise you this as well. This is one of those exercises where what you put into it, you are going to then get out of it. Now, what you'll see in my video is that when I have somebody performing a straight leg raise, I have one knee bent. That's because we need to protect the spine and the trunk. It's important. Then the leg that's straight, that's going to be the moving leg. Now, with that moving leg, I am encouraging my patient to make sure that they are tightening up that quad muscle as hard as they possibly can. Now, when you're engaging that quad muscle, there's only two big things that I typically don't want to see happen. You should not be recreating pain anywhere. You should not be hyperextending your knee. All right, just like you'll hear in the video, my hypermobility people, my laxity people, I hear you, I see you. All right, I'm thinking about you when I say that, because we don't want to just be overstimulating and then just re-encouraging bad habits of consistently being in those hyperextended positions where you're going to get a significant amount of not ideal joint contact there. In fact, for my patients that are hypermobile, you're going to get even more benefit out of it because you're really having to learn that proprioception and that body awareness. All right, so we're relying on our back. We have the non-moving leg bent. The moving leg is straight. We've engaged our quads, the top of the thigh muscles as hard as we possibly can without recreating pain and without recreating hyperextension of the knee, a backwards bending of your knee. And then you are maintaining that effort, which should be high effort. I don't care how high level you are, how strong you are. It should be extremely high effort for you to be engaging that quad muscle, putting everything you got into it, and you're going to maintain that until the moving leg gets to the height of your bent knee on the other leg. And then this is where it gets challenging. You're going to maintain that same intensity until you lower the leg back down, all the way back down. Some of you, I'm talking to you where you like to go 90% of the way, not 100%. All of the way back down, okay? You do not release until your calf hits the table. If you're doing it with shoes on, you get a little bit of a break because the heel of the shoe might hit before your calf does. But you do not release that muscle until your calf hits the table. Now, a lot of my patients are eager to get better, right? So they want to rip these reps out. They're just trying to go, go, go. And I'm going to stop them and I'm going to say, wait, once your calf does hit the table, I actually want you to stop. I want you to take a break, even if you can keep going. Stop, completely let those muscles release, shake it out if you need to, okay? Because Teaching muscles how to disengage, turn off, or inhibit, whatever words you want to use, is just as important as teaching those muscles how to turn on. And for a lot of my patients that have an athletic or very active lifestyle type of background, they are used to turning muscles on. That's not the hard part. But the hard part is teaching the body, teaching the brain when we've been in pain or limited in our function and we've been guarded for so long, teaching the brain and the body to release so our muscles can work efficiently can be the challenge. So between every rep, especially when you're early in your rehab, this may change, but when you're early in your rehab, every rep, I want you letting those muscles completely turn off. So then you have to teach them again how to re-engage with that strong contraction, working as hard as you possibly can, mitigating for any sort of pain, and then not allowing that hyperextension of the knee as well. Now, the certain rep count, the how many times per day, how many times per week, how long of a rest break do I take, that's all going to be dependent on the individual. Chat with your local healthcare provider, chat with your local PT that you may be working with. You can message me directly for your particular situation. But we got this. Straight leg raises, Movement Monday, less can be more. You got to master the foundation, master the building blocks before you can advance to the more dynamic, more creative stuff. The basics. Let's get it. Movement Monday, resilient rehab and wellness. Stay happy, stay healthy, never satisfied. Now I'm rambling. Now we're officially done, I promise.